Hey everybody, how you doing? Uncle Vinny here. You know what's coming up? That's right, Health Chat. Grab a cup of coffee, sit back, relax, and enjoy the show.
So, check some stuff out and see how it's doing. That's a little tight. Not terrible, but,
Yeah.
but a little tight. Did you work out today?
I did. Did upper body today. Yesterday I did lower body.
Worked on your guns, didn't you?
Yeah.
Feel how tight that is on that side?
Mm-hmm.
That right side's a lot tighter than the other.
So I feel like it's a lot better than it was before.
Oh,
several
yeah.
weeks ago. But yeah, it's still definitely have some tightness in my hip flexors.
And every time you come in, I'm always checking this. They're basically orthopedic tests that we're doing, checking things out, making sure, ooh, that was tight, tighten the tush. Just like this. Oh, yeah. Feel how tight that is in the groin area?
Mm-hmm.
So. And when you first started, you feel how easy that is? I mean, your right side's the worst.
Yeah, there definitely is a difference.
We're checking your iliopsoas muscle right there. Feel that? It's tight. Not so bad. Still tight. Is it? Can you feel that?
Yeah, it's just more
Not as-
sensitive on the right side.
Yeah. Okay, straighten this leg out. Squeeze up. Kind of work those trigger points out.
Wonder too if, because of my foot surgeries, the right was the one most recent, even though it was a year and a half ago. So, because when you're at a knee crutch
Mm-hmm.
for about 3 months, so you're off center.
Oh, yeah.
It's like having crutches where it just messes you up. It could be.
And part of it is,
Lingering.
too, you sit for your job.
Yeah.
So you're in this flex position, so this muscle stays flexed.
Mm-hmm.
Roll towards me, please.
And I'm trying to stop crossing my legs when I when I sit.
It's hard.
It is very hard.
Ooh, right there. Feel that?
Mm-hmm.
I'm touching and I go, can you feel that? Of course you can feel that. I think it's really important for people to understand that, just because you're working out does not necessarily mean that you can't injure yourself, number one, and number two, that you may not be working out correctly.
Right.
A little bit. How's that feel when you do that? Any pain or
No.
tightness in there?
Well, tightness, but it feels good.
Getting it opened it up.
Yep.
Okay, let's go to the opposite side, please. Now they get to see my good side. Wow. Really tight there. You've been working out.
Mm-hmm. How old am I? Maybe 15 or more years. With an emphasis on weightlifting in the past 10 or 12 years.
Relax your hips towards me a little bit. There it is. This way. It's funny. I used to work out. Like when I was in college, we would play racquetball stuff, but I didn't do any lifting. So, right here, let it go. Here, that was easy.
Yeah.
You know what I need to do when we put this out? I need to put that crack sound in there so people get excited.
And like some explosions.
Exactly. On your back. That's funny. A little better.
Yeah.
Oh, look how much easier that is.
And I've really been, almost every time I work out, no matter what muscle group I'm working on, I try to do hip flexor type mobility exercises. Not just stretching, but more active.
Oh, yeah, absolutely.
Active movements.
That feels a ton better.
Yeah.
Another thing that we dealt with you were working on, you couldn't get your arms back when you
Right.
were working out. How's that been doing?
It's better. I mean, it's one of those where I know it's going to be slow going, and I am seeing progress, but I can tell, it's definitely, now that
Sit
I'm
up.
focusing on those exercises, I'm realizing just how tight it is.
Yeah, that's why we want to look at that. Right here, feel that?
Mm-hmm.
That sore there?
Yeah.
And I think we talked about it before, when you're working out, you develop pain in the chest area that you don't even realize, and it manifests itself in this low back. So
one exercise that has been kicking my butt is so laying basically stomach on the floor and just taking one of the broomsticks. So it's kind of like the YT position.
but you're on your belly?
You're on your belly, and so you try to keep it, you're keeping the weight this
Right.
way, and you're going without hitting your head.
That's hard.
Yeah, with a broomstick.
Hey, Shay, can I see you in the activator, please? Okay, let's get you on your back. We're going to adjust those ribs. You know, I've been practicing a long time. I see people that get this out. I'll tell you, this activator, people are like, what is that? It doesn't do anything. It does. So I'm going to have you place your hands on your breast, pull breast tissue apart. And for people watching, there is somebody watching me do this. Because I would never do this to somebody if they weren't in the room. And we're just loosening up these ribs here. That's going to sound good on tape, don't you think? Because if we don't work this shoulder girdle and all the parts of the shoulder girdle, including the ribs, it's not going to work. Thank you. So, turn away. That's just to prove that somebody was there, you know. All 24 people will watch this after they say, okay, bring your arms back. Hey, that was easier, wasn't it?
Yeah.
Okay, now, what I want you to do is I want you to hold your arms to your side, and when I tell you to lift them, I want you to lift them, okay? So...
Sitting or standing?
Yeah, no, you're good. You're good sitting. Okay, lift. Hey. Do you remember when we first did this? We couldn't get the scapulas to move? Scoot back. And I gave you those exercises for scapular dyskinesis. I want people to see something. Turn your head to the right. Good. Now to the left. See how much range of motion you have in there? You have a good range of motion. Relax. But your tension is right there. Feel that? Okay, so let's fix that. Let's have you sit right here. I did a video with a woman who was pregnant, and was like, they get totally adjusted differently. Huh? Ooh, they heard that. Good. That was easy. Turn it on. Oh, that's so much better. Now let's bring your arms back. Like you did. No, like you did.
This?
Yeah. Yeah. See you. That feels pretty good, doesn't it? That doesn't hurt when I do that, does it? Okay, good. Boy, that was easy. Good. Stand up, see how that feels. How's that feel in there now?
No, a lot better. This
Lot-
one first was kinking.
Yeah. Now now you're not getting any clicking. All right. Let's head out in the gym area, and I want to show that squat, how you do your squat, and how we changed it, which makes a difference. All right.
Okay.